Good afternoon, everyone, or good morning as the case may be. Thank you for joining us for this month's Strengthening Families Networking webinar. I'm Kaylin O'Connor from the Center for the Study of Social Policy, and I'm very glad that you are all with us today. We're going to have a great presentation about child maltreatment prevention planning, specifically focusing on what they've been doing in Colorado, and we want to hear from all of you about what's going on in your states and how your prevention planning connects to your Strengthening Families efforts and all around what you're up to. So I will get us started here. Our agenda today will, as usual, share some updates from CSSP and from the National Alliance of Children's Trust and Prevention Funds, our co-hosts for these webinars. And then we'll hear about child maltreatment prevention planning. Our main presenter will be Kendra Dunn from the Colorado Office of Early Childhood, and unfortunately Deb Darrow, who was going to be presenting with Kendra from Chapin Hall, is ill today and not able to join us. I've just been told that I'm a little bit quiet, so I'm speaking into a microphone. I'm going to try to make sure it's very close. Feel free to type in if that continues to be a problem. Okay, so let's get us started. Here I am, Kaylin O'Connor from CSSP. I'm just going to share a few updates today and make sure for those of you who are newer that you understand what webinar you're tuning into. This is our monthly Strengthening Families webinar, open to anyone who's implementing Strengthening Families in a program, an agency, a community, or a state, and who's using the Protective Factors Framework in your work. Each month we coordinate a different topic, usually with a guest speaker, sometimes with a panel, to focus on a specific aspect of Strengthening Families implementation. And so you may find that it's only occasionally relevant to your work specifically, or you may find that it's often has some themes that you can use in your work. You're welcome to come to the ones that work for you and skip the others. And we encourage you to invite folks in your state or community who might be interested in a particular topic. You're always welcome to forward the invitation to others. We do announce these through the Strengthening Families e-update newsletter. If you don't receive that, you can go to cssp.org, and on any of our pages, really, you can click on something like Stay Connected and sign up for that newsletter and other newsletters about our work at the center. The Alliance, our partners at the National Alliance of Children's Trust and Prevention Funds, always post the recordings and slides from these webinars on a site that is now a very rich archive of all those materials. So I encourage you to go there when you miss a webinar, or even just to browse through and see what past topics have been and see if there's anything of interest. That site is there, and also we always link to that in that e-update newsletter. So we do this on the second Thursday of each month at this time. Our next webinar after today will be on August 10th, and there we're actually going to use that time for a Strengthening Families Technical Assistance Clinic. We've done this a few times before, try to do it maybe a couple times a year, and it's an opportunity for you to ask and answer questions about Strengthening Families implementation. So if you have a really practical question about sort of how did you overcome this challenge in your community, or what's the best way to reach a certain audience, you can share a question like that, or you can ask a bigger question about sort of what is resilience, and we'll get some people to talk about it. It should be interesting. I will answer the questions. Martha or Teresa from the Alliance will answer questions. If you send your questions in early and I can pull in someone with some specific expertise to answer that question, I'll try to do that. And then you can also answer each other's questions in that conversation. So I hope you'll be able to join us, bring your questions, which you can fill in on the form when you register for the webinar, or you can email them to me. And you can also ask them at the time, and we'll try to get to as many as we can. So I hope you'll be able to join us for that on August 10th. And then mark your calendars for the second Thursday of each month going forward, and we'll announce those topics as we go. Just a couple other announcements from CSSP. I'm still working to gather translated Strengthening Families materials. We get a lot of requests for particularly Spanish language materials, but certainly we know depending on the communities you serve, other languages are also relevant. And we haven't until now gathered all the translations that have been done out in the field so that others can also use them. So I just encourage you, if you have translated any materials and are able and willing to share those with other people in the network, please go to this Google form add those translations to the list. If you have posted them somewhere, then there's a spot on that form where you can put the link. But if you haven't posted them somewhere, you can add them to a folder on Google Drive. We're trying to be very technology forward with this. We'll see how it goes. So you can put things into that folder. You can go look in that folder and see what's there. Right now we have a couple things in Spanish and one parent brochure in Haitian Creole. And you can check out what's been shared by looking in that folder or looking at the form, the spreadsheet that's generated from the form. If you're not into all the Google stuff, you can just email me your translations and let me know that you're happy to share them with others, and I will add them to the list. And I hope this will become a resource so that if you need a material in a specific language, you can go look and see what others have done, and it might meet your needs, or it might give you some shortcuts for how to translate some of the terminology, so you can use similar language when you translate it into whatever you need to translate into another language. I also wanted to make sure that everyone's aware about the revisions that are going on to the Protective Factors Survey. The new version of it is going to be called PFS2. This is being done at the University of Kansas through the Friends National Resource Center for Community-Based Child Abuse Prevention. They are longtime partners of ours in strengthening families, and so since I know many of you are using the Protective Factors Survey to help parents assess their own growth on the protective factors, I wanted to make sure that you're all familiar with the revisions that are underway and that you know you could still sign up to join the field test. So there have been a couple of recent blog posts by folks at the University of Kansas. They're linked here, and if you're funded through CBCAP, you could go to your state CBCAP lead also to find out if you're able to participate in that pilot. Okay, someone just said I'm still too quiet, so I'm trying to speak up, but luckily someone else will start talking soon. So with those updates, I'm actually going to hand off to Martha Reeder, my colleague at the National Alliance of Children's Trust and Prevention Funds, to share some updates.
Thank you, Kaylin. Good afternoon, everyone. You can go to the next slide now, Kaylin. Just a little update on the training of trainers that the Alliance has been doing over the past several years. And we now have over 800 certified trainers across the country. And this spring, we've had trainings in Sacramento, in Medford, Oregon, in Petoskey, Michigan, and in Denver, Colorado. And so we have a couple of upcoming trainings, one in Los Angeles in August and one in Kenosha, Wisconsin in September. And if you are interested in participating and becoming a certified trainer through this Training of Trainers event, please contact me soon about the Los Angeles training and also about the training in Wisconsin. We would love to include you in that group. Thank you. We can go to the next slide. The Alliance has been working on a couple of really exciting projects around the prevention of child neglect over the past several months. One of those projects is a project with CANTASD, the Child Abuse and Neglect Technical Assistance and Strategic Dissemination Center, funded by the Children's Bureau. And we're hoping that that one will be out very soon, and it is a training, a four-part training that will have a guidance and a lot of suggestions about ways to use the training in different contexts. So we're very excited about sharing that with you and hope to have that to share sometime in September or October. And also we're partnering with Friends National Resource Center on several projects around preventing child neglect. In the next couple of weeks, actually the 25th of July, Tuesday, Meryl Levine will be hosting a webinar to explain to parents some things about how we want them to help share their stories around child neglect. We are seeking parents who will share by video, audio, or by just writing their stories down, brief vignettes that about how someone or something helped them to avoid potentially neglectful situations with their children. And the webinar on Tuesday, July 25th is going to be sharing a lot of information about what all that means, what are some strategies they might be thinking about, some ways to share their stories. And anyone who is interested, please contact Meryl Levine, and she will send you the information that you need to log on to the webinar and the advanced materials that you need to read or look at before that webinar occurs. So please share with any parent groups that you have or anyone that works with parents that might be interested in this information. One other little thing that I would like to share with you is that in the last couple of weeks, a very historic gathering of birth and foster parents was held in Seattle, and this was under the auspices of Casey Family Programs, and with a lot of the work that the Alliance is doing with the Birth Parent National Network. And so there were 32 birth and foster parents representing 30 diverse communities in 13 states. They met for 2 days at the Birth and Foster Parents Partnership convening in Seattle. And they discussed ways that foster parents and birth parents could work together for the good of children and for the good of the system, to improve the system. In the upcoming months, the Birth and Foster Parent Partnership will continue to work together to develop long and short-term policy priorities and develop some policy statements and propose recommendations for consideration by policymakers at the local, state, and federal level. So this is something we'll be informing you about as it unfolds and as it develops. And if you're interested, again, if you would contact Meryl Levine at this same email address that you have here on the screen. And that's all I have today. Thank you, Kaylin.
Thanks, Martha. I appreciate the updates and glad to hear how successful that meeting was with birth parents and foster parents. Okay, so we're getting to our main topic now. As I mentioned, Deborah Darrow is actually ill today and unable to join us, so Kendra Dunn is going to be carrying this entire presentation bravely and generously. So thank you, Kendra. I know you've been working closely with Deb, so you know all of this very well too, but I know you weren't planning to present on it today until this morning, so thanks for stepping up. Kendra is the Child Maltreatment Prevention Director in the Colorado Office of Early Childhood, and a great partner in thinking about child maltreatment prevention for a long time now. And so I'm excited for her to share what they've been doing in Colorado and how it connects to their Strengthening Families work. Kendra?
Great, thank you, Kaylin. Hello, everyone. Today we are really hoping to share a little bit of information about the way we are doing child abuse prevention planning here in Colorado, but we recognize that several of you have probably heard this before. In addition to the quick overview, we're really going to focus a little bit about how we embedded the protective factors framework into the work that we're doing, and then hopefully hear a little bit from Massachusetts about a journey, a kind of companionable journey that they've been going on as well, and then would love to, if people have questions or comments and want to share some about what's happening in their states and how they're connecting their Strengthening Families work to child abuse prevention planning, that would be great. So even if you've heard this before, hopefully there'll be something new or some way for you to weigh in. So quickly, for those of you, and I don't know if I have the ability to advance slides, so I'm going to probably have to ask. If we could move to the next slide, thanks. For those of you who, just a quick overview for those who haven't heard kind of the journey that Colorado has been going on with South Carolina and Chapin Hall and the Office of Child Abuse and Neglect, and in our case, a philanthropy, an important philanthropist in Colorado, which is a new charitable organization called the Zoma Foundation. So we've been working together. We started this process actually about 2.5 years ago because we were excited about the gains that we had seen in the prevention field over the years. So some of those things were, there definitely had been a trend of growing awareness of what child maltreatment was, its complexity, certainly through the ACEs work, its long-term impacts, and that's all good. That brought our awareness of it's a problem and it's important. We certainly, over the past couple of decades, have seen a robust and diversified array of different programs that have been developed and evaluated in terms of their ability to help prevent child maltreatment, especially around home visiting, but also other parent education and family support programs. There has been, I think, a broadening conversation around efforts like the Strengthening Families Initiative to really look at system reform and strengthening child outcomes across different fields of practice and at different levels within each system. And overall, children are doing better. That many threats to child well-being have been improving. So a decrease in teen pregnancy, a decrease in certain types of child maltreatment, less children in foster care. So there's definitely been some data trends that are showing us that we are making some improvements for children. However, with that being said, if we go to the next slide, there remains some persistent challenges that we were trying to grapple with as we started this last process for that journey that we're on around doing some new planning in our state. One of them was, despite some of our efforts, we definitely still see silo thinking and folks working within silos. There definitely still are some things around community norms and kind of the context in which families are raising their kids that is impeding our ability. Just working with families one-on-one in home visiting programs or parent education isn't, it's helping, but it's not, completely solving the whole problem of the context that families are raising their families in. Often some of the highest risk, or in Colorado we would say at risk as opposed to high risk, but families are not often engaging into the program. So we're meeting, getting and serving some families really well, but we think there are pockets of families that aren't getting to the services. Colorado is a state where our human services and public health systems are locally run at the county level. We are not a state-administered state, so we see wide variability across our systems and our communities in terms of service quality and accessibility. And then, I think something that the field has been grappling with for at least a decade is messaging around prevention and how we get better and better at generating this sense of collective responsibility for children, that sense of we're all in this together. So we were really mindful of these kind of challenges as we started down this path. We are a CDCAP state lead agency, and in trying to obviously fulfill that requirement, we do regular needs assessment, but it had been a number of years since we had done a new child abuse prevention plan. And to be totally transparent, we had this really gorgeous book-bound child abuse prevention plan that was written in 1995, and it had good recommendations in it, but it got, sat on a shelf, and I don't think any of those recommendations came to be. And so as we started this, we really wanted to do something different. We definitely didn't want to just repeat kind of that traditional child abuse prevention planning process we had used in the past, because we didn't want the same results. And so in conversations with Deb, she was really encouraging us to think beyond this idea of, just identifying a menu of interventions or programs that could be run, that it was really important that we think about assessment and indicators and outcomes and how we were going to measure impact across sites and across strategies, and just that we go into this really thinking about the process that we were going to use and what barriers there would be to implementation, and how could we kind of recognize and mitigate some of those barriers as we were going through the process, instead of just kind of creating this great deliverable or product and then trying to deal with why aren't people using it, or why isn't it working. So that's kind of the context that Deb likes to lay in terms of like where we started down this path. So I think I mentioned briefly kind of our partners in this process. It really kind of created a brain trust of folks to think together and bounce ideas off of each other. The Federal Office of Child Abuse and Neglect had funded CSSP to help support this process. And I know that it's not up here, but South Carolina was aided also by the Blue Cross and Blue Shield Foundation, and we were aided by what is now called the Zoma Foundation. And so really all the way from the beginning there was a intentionality about including philanthropists, or those with money and resources, to help us think through what we should be doing and how, so that there would be ongoing support for the implementation of ideas. Okay, so in Colorado, we spent about 2 years going through this approach. We started by doing a round of, I think, up to 35 key stakeholder interviews. But what it really did was it helped us identify kind of what were some of the efficiencies, where was their ability to look at common work, and for lack of a better word, shared values. Like, what were the things that were really important to our agencies, our administrators, our legislators, our funders? Where were we starting from? And we ended up, you'll see later, calling those foundational principles instead of values, but really all of that came out of our initial stakeholder interviews. We then really spent some time looking at the prevention landscape in our state. So what are the things going on? Who's doing what kinds of other plans, what kinds of other initiatives and pilots were going on, what were they trying to drive to? And then really were able to coalesce those into a set of shared outcomes. There's already a lot of work in our state working towards the 4 outcomes that we landed on. We didn't want to come up with a menu of here's the programs you should fund, but we did feel like we needed to put some, kind of create a roadmap or some guardrails as people thought about what they might want to do in our local communities to prevent child abuse. So we kind of created a list of promising things that we saw happening either in the state or other places in the country that had some research behind it, but they weren't all, some of them are evidence-based, they weren't all evidence-based, some of them are innovative but being evaluated, but really trying to kind of say, here's some things to think about without forcing them to say, you have to pick one of these things. And then we spent a lot of time developing a toolkit that our local communities could use to tailor our framework to their specific needs and to really create a strategy for them going forward on how they were going to approach child abuse prevention efforts in their community. So those are kind of some of the steps we went through. I mentioned the foundational elements. Those were really kind of our values, our foundational principles, our core set of outcomes. We did then spend some time looking at related indicators. So how would we know if we were moving the outcomes that we wanted? And what we came away with was that there was a need for us, at least here, to align individual and population level data. So, there was a lot of data we wanted that we didn't have, and we know that it'll take a while to kind of build capacity to get that kind of data. So we had to start by looking at what did we have. And we had some good data on the population level through surveys like the National Survey of Children's Health, or our PRAMS or BRFIS surveys, through our SACWA system, which is called Trails in Colorado. In some of those cases, we had data at the state level, but the sample sizes weren't large enough to have regional data or geographic data, which when you're planning at the community level is really important. And so identifying those indicators on those larger population level instruments allowed us as a funder to think about how we might ask sites in the future who are implementing strategies to ask those questions at the program level, so that ultimately we would have on the same questions some community level data as well as some population level data to track. We identified our high priority options. This is really, again, kind of what I was talking about best bets, or, here's some things to think about, but it's not a list of have to or a list of everything you could ever do. It's a list of where we think making investments makes sense right now. And Chapin Hall did then create a literature review around those best bets that is available for all, and I will show you at the end of this presentation where to find it. And then really we focused on, okay, great, so now that we've created this framework, we're going to move into supporting communities and doing some strategic thinking and planning at that community level. What kinds of tools would they need? What kinds of support? And so we've moved that forward as well. Next slide. So for us in Colorado, the foundational principles that we landed on were really these six things. There was a need to not only look at evidence-based programs, but to also think about how we're implementing them. So implementation science was really important to the people that we talked about, especially recognizing that even when we had really great evidence-based programs happening in our state, they weren't happening at scale. So, we had a lot of work to do to think about, if this is great and it is so successful, how would we be able to do more of it, and what kinds of implementation barriers would exist to being able to scale things. We heard a lot about the importance of workforce development and the folks who are working with our families and what they need. And so it just became a really foundational, if we can't take care of the people that are delivering the programs, they have a harder time taking care of the families they're working with, or nurturing the families they're working with. There was lots and lots of conversations around data integration, which should not be surprising. How do we share data? What is appropriate? And what would we gain by being able to address some of those barriers and being able to share and aggregate data? So that we can see long-term outcomes better and understand how certain strategies or interventions work together to collectively get an impact. So that became something that needs to continually be worked on here, but also across the country. Lots of conversations about continuous quality improvement, and really, no matter how well we're doing, how we're going to keep learning and how we're going to keep using that learning to evolve our practice, that there's really never any good enough, that really we want a culture that in Colorado that says we're going to keep pushing for better and better and better. One of the really important things from our Strengthening Families work that got embedded in our foundational principles was participant voice, really the need to involve families and clients at every level, and I'll talk more a little about that, but this became really important, and for us really also included that idea around embracing diversity and inclusion, right? That you can't do those things well if you aren't really bringing all voices to the table and respecting and listening to them. So it's not that we didn't think about diversity, we just really felt like it fit along with honoring parent voice. And then policy integration, that no matter how great the programs are that we run, that there's work that needs to be happening at the community and societal level of the social ecological model, and that policy reform really has the ability to institutionalize the things that we're doing well, but also to push change. And so we really needed to be thinking across all those levels. So that all kind of came out in our, if you're working with children and families, you need to care about this, even if you, no matter what program you're running or what specific project you're involved in. And you will notice that the levers that we talk about in the Strengthening Families Protective Factors framework, they're here, right? The policy piece and so I just, again, slightly different words, but we were really intentional about embedding all of the Strengthening Families philosophy that we have been working on in the state into this framework. Next. So we ended up on these outcome domains, child well-being and achievement, which I think is something that in child abuse prevention we've always focused on, right? How well are children doing? How are we maximizing their development? Our second outcome, I think for us, at least in Colorado, was kind of the first time we've really called this out in the context of child abuse and neglect prevention, which is how is the parent or caregiver doing in their own right? So what is their well-being and achievement looking like? Do they have good health? Do they have the educational opportunities they want? Are they able to, have careers and development in those careers? So aside from their role as a parent, but just in their role as a human adult, are they thriving? Then our our third outcome was around consistent high-quality caregiving. So parenting, caregiving with early childhood providers, truthfully, other caregiving that happens within the family, caring for elders, siblings caring for each other. How are we nurturing what good caregiving looks like, what good attachment, what good healthy relationships look like, knowing that that fosters positive child development. And then the last domain was really the context piece that I talked about earlier, safe, stable, and supportive neighborhoods. How are we creating environments that make it easy for families to be successful, and how are we creating that collective responsibility for children? So those were the 4 outcomes that we are pushing towards. And then we identified intervention pathways here in Colorado. We're calling them channels for change. So you'll see a little bit different language here in a minute when I show you the Colorado framework. But really, this is to that point around the social ecological model that we're looking at universal and targeted services to families. We're looking at flexible funding, which obviously is happening at the administrative and societal level and policy. We're looking at making sure that we're thinking about integration of, health and mental health and other co-locating of services and philosophies, and that we are still supporting using what we know works. So, what does the research show us in terms of evidence-based models and practices? So, it's nothing new here, hopefully. This is all stuff that we think about, that we talk about, that we know is important, and it was a way of kind of laying them out in a roadmap together to help guide our community's thinking. So the next slide, sorry. Deb, on this slide, this is the last slide of Deb's, and what she likes to say here is mostly that we've identified some things we know are really important. What we're not quite clear about yet is how they all fit together, and that's kind of the journey that we're on, that we know these things all have promise or evidence or important, and so we need to keep an eye to all these things and be mindful of them so that we can continue to learn how they fit together and reinforce each other to really increase family well-being and prevent child abuse and neglect. So with all that kind of in mind, that's the quick overview of how we got where we are. This is the Colorado framework, and mostly I've covered, you don't have to read that. I know it's really small. You can go to the next slide. Mostly what I wanted to show, because I kind of, as we went through Deb's slides, talked a little bit about what's there. I wanted to show you where we feel like we embedded the protective factors. And then, feel free to ask further questions later about that. But so in our foundational principles, we really feel like the honoring family and participant voice value came out strong and was really reflective of the Strengthening Families work that Colorado has done and continues to do, and the importance of not only helping families and communities build protective factors, but the importance of engaging families in doing that work. So, so we definitely call that out there. In the next slide, we're going to look at our channels for change. Oh, sorry, we're going to go to our outcomes. So both in how we worded our outcomes, but then also kind of some of the indicators that we established really speak to the protective factors. So under child well-being and achievement, we really called out social emotional health or social emotional competence. Under caregiver well-being, we were really thinking about parental resilience and concrete supports and social connections and called out those things. Under consistent high-quality caregiving, we really pulled out knowledge of child development and parenting. And so, like I said, it is different words, but the protective factors are all here in what we're driving toward and what we're going to be measuring. And then if you go to the channels for change, I just wanted to call out, and it's maybe not a different enough color, but that blue arrow is pointing to a piece on the framework that actually says, no matter what individualized service you select, it has to build protective factors and use a two-generation approach. So we're really kind of also establishing some values around our programming, that our programming, whether it's home visiting or whether it's family and goal setting, that it is designed to help build protective factors, and that it needs to be focused on the whole family and the needs of the whole family. So I think that's the last specific slide around the framework itself. I want to talk a little bit about where we're headed. So we've launched our framework April 27th, and now we're kind of in phase 2, which is actually now going out to these communities. Chapin Hall did finalize a community planning toolkit, which has a lot of great information, plus all the tools that were developed and used at our state level. So our parent surveys, our focus group guides, all are included in this toolkit for free, and anyone can use. And you can download that toolkit at www.co4kids.org. That is also the literature review that Chapin Hall did is also there. Eventually, all this material will also be up on Chapin Hall's website, but it has not gotten up yet. So that's why I'm driving you to the Colorado website, so you don't have to wait. If you want to grab it now, you can. We are in the process now of, we have built a team to help support community planning. So we have through foundation funding, we developed or hired a full-time position to support communities in doing this planning. They will provide TA, they will help provide facilitators for communities to facilitate meetings as they go through this process. And they will receive, training and financial support. So we've kind of built the team that will be providing that over the next 18 months. In Colorado, we are in our pilot going to work with at least 16 communities in 2 cohorts. So we're about to release the solicitation for our first cohort, and then we'll do a second round. We anticipate these communities will plan for about 6 months each, and certainly Deb has remained on this project with us because she'll be helping kind of collect learnings from both cohorts and then sharing that back out to the field around, what as communities started to do planning with this framework and with this toolkit, what did they learn, what worked, what would need to be changed, what barriers did we not anticipate. And so that'll be coming, in about a year, but is kind of our next step in this journey. And then let's see what's next. So I talked about identifying the pilot communities. We will be creating peer learning opportunities for these communities to be sharing information across learning as they go through the process. We'll be monitoring impact, both in terms of process. So what are the benefits of the outcomes that are happening as a result of just going through this process, as well as in the long term creating a dashboard and really tracking those indicators to see if we're moving our outcomes. And then we remain committed to sharing and working with other states on their journeys and how they can inform each other. So with that, I think the next slide is the one where we're going to ask Susan Bartley to talk a little bit about what they are doing in Massachusetts.
And actually, before we jump into hearing from Susan, we had one sort of a clarifying question that came in while you were talking, Kendra. So
Okay.
I will read that to you. Kate Bullock asks, the planning for 6 months in each of those communities, what will that entail? What will they actually be doing?
Excellent. So it is all laid out in the community toolkit, but basically in Colorado they have the benefit of already having our framework. So we've basically kind of already set the guardrails. So they will start by identifying and analyzing their local community data. There isn't time for them to collect original data. So they'll be pulling and looking at things like the annual Head Start assessment in their community, the kids count data, the local, administrative data on child welfare or public health outcomes. We will show them kind of the state level data on some of the children's health and PRAMS type data that we identified. And then they'll spend I guess I should have said they first need to develop a core team. In a lot of our communities, they already have a multidisciplinary core team that's working on something else. It might be working on child fatality review, or it might be working on a project launch, grant, or it might be an advisory group to a home visiting program. So they can start with a group that they have, but they'll identify a core team. That core team will initially kind of have conversations about and analyze some of their local data. They have to do some kind of outreach, new outreach specifically to parents. So we're encouraging them to not only have parents on their core team, but then they also have to do some kind of parent focus groups or parent surveys. So they're really right from the beginning grounding their decision making and what families are telling them are needed and desired in their community. And then they'll do some kind of strategic decision making around, okay, within each of these channels for change, what is something that we feel like we can expand or implement new for our community? So what policies are important, what's going on with workforce development or community norms, as well as what kinds of programs do we want to expand or implement new. We are definitely not focused on it has to be new. I mean, we are really, this strategic decision-making process can absolutely reinforce that there is something that's working and they want to expand it so it can impact more families, or so it doesn't have to be new, but we really want them to try to identify a strategy within each of those channels for change. Once they've done it, they're really going to mark clearly which outcomes they're moving towards and tracking which indicators with those strategies. And then they will have the ability to apply for funding. So in Colorado, we will start out by using our CBCAP funding to fund implementation of some of these plans or fund pieces of implementation for some of these plans. Zoma Foundation has also agreed to fund implementation for some of these strategies. And we're continuing to build the opportunity for additional resources. So working with more foundations, more private philanthropists, more state agencies to really think about what additional types of funding can we bring to the table that would help fund strategies at the different channels for change. And so after that 6 months of funding, they should have enough, be far enough down in their decision making to be able to apply for some of those funding streams to start doing the work.
Great. Thank you, Kendra. That was a great answer. I see that we have a couple other questions coming in, but I'm going to take a moment to check in with Susan Bartley, who's going to share some of what she's been leading at the Massachusetts Children's Trust. Susan, are you there?
Yep, I am. Thank
Great.
you.
Thank you.
Can you hear me?
Yes.
All right. We came to this, this has been fascinating to me because it's, Colorado has, has counties, and often in Massachusetts, when we look at what Colorado is doing, or South Carolina or other places, they are very county regulated. However, in Massachusetts, the county structure really does not exist. And so we're a little bit of a smaller state, so therefore it really comes from a statewide down into the communities. Really how this started was a little over 2 years ago. We had had a horrific incident of child abuse and neglect where a 5-year-old had been unaccounted for, even though he had been in, his family was involved in the Child Protective Services. And my board chair, who is the head of the Chamber of Commerce, just had an intense reaction and just kind of turned to us and said, you know what, where is the systemic response here? I understand the response once child abuse and neglect happens, but it doesn't seem to me that there's a continuum or any systemic response to how we prevent this overall. And while in Massachusetts we have had great success with a universal home visiting adaptation of Healthy Families America statewide for every first-time parent 21 and under, and that has been heavily evaluated by Tufts University, process outcome ethnographic, randomized control, and we are just in the beginning phases of getting longitudinal results 5 to 6 years out. So we've been involved in, doing that kind of data and looking at it. We had also been funding for 20 years 7, now 8 family centers, and looked at, here we are, I think, funding these great programs, but how do we really look at it in a different way? So we stepped back and we said, okay, we can't do this statewide, but if we could create what we call safe child communities, safe being stop abuse for every child, and what would they look like? And I think the premise is that it takes the whole community, and that from there we went to, okay, we developed a very, very comprehensive logic model, which I'm happy to share with anyone, then began talking to national experts, including Deb Darrow, and developed a 25-page lit review, and really took a deep dive in looking at how we could do this. And after Lee Shore was up here this fall for a conference, she spent a day with us and kind of shook us to saying, why are you trying to create something new? Let's take the existing family centers and why aren't you building on them? And so indeed that is our plan. And I think a lot of what was mentioned earlier in terms of Colorado, the importance of workforce development. We've trained all of our home visitors, get about 127. Supervisors get over 150 hours of training from us. The data integration, we're very lucky in that when we began the process of evaluating our home visiting, we have an MOU with the Department of Transitional Assistance, the Department of Children and Families, the Department of Early Education and Care, the Department of Public Health, and the Department of Elementary and Secondary Ed. So we have a very robust data system and a lot of data that can complement that. What we learned, and I would say this from the bottom of my heart, is when you're developing any kind of data collection system, just like you want to hear the parent voice, it is critical that you pay attention to the user voice, that person who is putting in that data, and make it as easy and as intuitive as possible. That has really helped us with our PDFs. We've been nationally recognized by Pew for that. So as we looked at this, we thought, okay, we're going to have to build on the PDFs. We talked to Tufts, and they've spent the last year looking at 3 of our home visiting, 3 of our family centers in communities, trying to understand exactly what the data is telling them in terms of the level of child abuse and neglect, looking at what those communities, doing the key informant interviews, how do the communities view it. So for example, Cambridge, Massachusetts, well-known home of Harvard, has incredible poverty and incredible wealth, all mixed in. In that family center, those families go there because that's where they can get sorted out and helped connect to a rather robust set of programs. where in Athol Orange in the middle of the state, very poor, our family center is seen as the provider and in a very different way. So we're beginning to understand that. But our goal is to create these safe child communities, start with a local community governance board, have them run with us a series of parent cafes to get an understanding of, looking at the key protective factors, what's robust and what's not in their own families, but also in their communities, to use that as a guide. Our plan is to provide with them sort of a menu so that in that, if you that was really good, Susan. If you drew a large circle, that is that community. In the center of the community is the family hub that then provides the referrals and the resources to families to kind of say, okay, you're looking for workforce development. How do we make that warm handoff? How do we get rid of all of those silos in our community so we don't know what each is doing? Lots of parent leadership. We've been doing parent leadership training on an intensive level for several years. That would be included. But in terms of our foundational premise, universal, evidence-based and evidence-informed, using, whether it's the quality standards from family support and home visiting, the parent leadership and partnership framework, evaluation, and then moving over to what are the values, and the value proposition is built on the 5 key protective factors. They are absolutely core. And in fact, when we look at outcomes, similar to Colorado, we are going to be looking at how do those outcomes play into the 5 key protective factors. So the community hubs will provide home visiting, so we can take our home visiting expertise, and that's our first kind of goal, is that universal home visit. Every new parent, I don't care whether you're on your 3rd or your 4th child, will get that universal home visit, so you get connected to the family hub. But at that point, you get to screen and figure out what's happening, and, if appropriate, fine, go to Healthy Families. However, if you've just moved into the community and you have an 18-month-old, you're not eligible. So making sure that that community that we are investing in makes some choices about, are you going to use PAT, HIPPY, what kinds of home visiting models would be helpful to you, and then going into the family hub where we've been providing those kinds of services, whether they're parent-child groups, whether they're that individualized help to the family to hold them together until, if they come in and they don't have housing, how can we help them until we can transition them into housing? So I feel like I'm running off at the mouth because I don't have slides, but I think that's it, and I'm open to questions. And I'm not sure if that's helpful, but there you go.
Oh, Susan, I think that was really helpful. Thank you. And you did see someone asked whether you had slides to go with it. So I know that you didn't prepare slides for this. If there's anything written that you'd like.
I was not asked to provide slides. We just had Deb here when we just did a soft launch of this in June. I am happy to send you slides. I am happy. We have also available Safe Child Communities, like 6, how many pages? About 10 pages, which I could make available if that would be helpful, and as well as the logic model.
That would be great, Susan. If you want to send those to me, Martha can post those when she posts the slides from this webinar with the recording. Yeah, send it to me, and then people who go to the site that you can always link to from the follow-up email, you'll be able to see that. So I did want to get to another question that was written in. I have somehow made my questions really tiny. There we go. So Debbie Peterson asked, what kind of strategies are used to incorporate participant voice? I think that's primarily a question for Kendra. So why don't you answer first, and then if Susan, if you want to jump into, you can. Do we still have Kendra?
Sorry, I had to unmute. Amateur mistake there, sorry. So in terms of strategies, there weren't a lot of strategies presented in the toolbox around the foundational elements, more resource links, but that's for us in Colorado, why we developed this a full-time staff position, and that will be overseeing a cadre of facilitators and consultants communities will be using. And so that support around strategies to implement parent voice and engage parent leaders at the core team, as well as roll out the parent surveys or parent focus groups. Communities could choose to use community cafes to gather that kind of information from families. All of that kind of support for communities. There are tools in the toolkit around the surveys and the focus groups, but then our facilitators would be the ones kind of helping communities identify, whether they wanted to use community cafes or what other types of strategies that they want to embed around honoring parent voice, and especially in an ongoing way, right? So we don't want them to do that just in creating the plan, but then also in implementation. So that really will get determined by the community. If you have a particular strategy you'd like to suggest, we would love to hear it.
Currently in Massachusetts, we do a lot of work within our family centers and within Healthy Families. Again, they are not brought together necessarily in one community, although they sit on each other's advisory boards. But my experience has been there's too many advisory boards for all of us to sit on. So we do require that parents are on all of the advisory boards within the family centers and have been doing that for 20 years. We have used and encouraged the use of parent cafes, and they are always received well, and I've never heard from either Healthy Families or a family center that they don't like them. They in fact love them. Carol Rose, who is on our staff, developed a 2-day parent leadership training. And we have used that first across the family centers, but have now also used that within the Healthy Families program. And finally, and I know this is a little strange, but one of the ways that we also hear parent voices is through evaluation. And Tufts going out and looking at and talking specifically to parents about what was the relationship like with their home visitors, and what kind of home visitors did they like better, and understanding what we need to develop in a workforce to make it not only effective but engaging has been very helpful. And understanding whether or not there's a match, or does racial match or linguistic match help, has been really helpful to us as we look at this. So thank you.
Thank you very much. One other question that came in was just about asking about the literature reviews that you both referred to. Kendra, I believe you said that's available on that Colorado for Kids website with the toolkit. Is that accurate?
Yes, that is correct, yes.
Okay, great. So I'll encourage people to go there. And again, Susan, when you send some materials, if the literature review is something you can share, we can link to it or post it.
I'm happy. I would be happy to share with you the logic model, the lit review, the 5-pager. I'll send you a bunch of stuff, Kaylin, and you can figure out what is appropriate.
Okay, great. Thank you so much.
You're welcome.
I think those are all the questions we have, and we are just about to the end of our time, so that worked out perfectly. I want to thank Kendra so much, and thank you, Susan, so much for chiming in. You both had such great information to share, and Kendra, I really appreciate you stepping in and sharing what Deb normally would have shared. You covered it very well, of course, and we're grateful, as always, for the work that you're doing in your states and communities, and glad that you took the time to share it with the rest of the national network. So thanks very much, and thank you, everyone, for joining us, and enjoy your afternoon.
Thank you all. It was a wonderful call.
Thanks, everyone.